I want to thank everyone for joining us here to share a webinar, a training webinar with our product expert for the MiraCradle Neonate Cooler. We're very excited to take you through this. It's been a few years since we've done one, so there's obviously new information we can share and maybe some new customers that we're working with that didn't see the first and wanted to join in a live environment versus just watching the recording. So for those of you that are new to working with VIA Global Health, I want to take just a few moments to introduce you to who we are and what we do. So VIA Global Health is a medical sourcing platform focused on underserved markets, and our goal is to allow you to source, quote, purchase, and ship products anywhere in the world. And we do that in a number of ways through our services, through our products, through our very transparent information that we share with all of our site visitors and all of our customers around the world. So I'll take you through very quickly just a bit about the platform so that you're accustomed. You can always reach out to us directly for more information, or if you want a more in-depth training about how to work with VIA, we're happy to do that as well. So the first thing I'd like to take you through is just the homepage. Very easy place to come in and see everything you need to know. So you can obviously search our site for all of our products, which I'll take you through in just a moment. You can also go through our shop categories. So you can look through shopping for products by category based on the room, so the clinical room environment. You can shop by the specialty, or you can just look at our latest products or all of our products. Those are really easy ways to see our full catalog of products. If you want to learn a bit more about VIA, we know that when you're buying medical equipment and you're procuring from suppliers you may be new to working with, trust and relationships is everything. So we want to give you all the information about who we are and even read a little bit about what our customers have said about us over the years, even some pictures of our successful deliveries and strong relationships. One of the other items that you'll find on our site are buyer's guides, which are essentially informational elements that you can read about certain product categories or product types to help understand how to make an informed decision. So what are the features you want to look for? What are the terminologies that are associated with that type of product to help you understand what it is you're buying so that you can make a more informed decision for your buying needs. You can see a little bit about our impact as well. So this is probably even a little bit outdated, but we have delivered products to over 70 countries and almost 2 million lives have been impacted based on our work, which we're very proud of. It drives everything we do is our impact. So a little bit of those testimonials that I mentioned earlier, just scrolling through so you can see. And as well, a few of our more popular products and featured products that we like to really display for our customers as they're looking for something new and exciting to potentially procure from us. So a little bit more in depth quickly about the About Us page, if you came over to that. So this is all about how VIA works, who we are, what we stand for. So we want to be as transparent as possible because we know that trust and relationship is what drives your business and it's what drives our business as well. So you can look a little bit about who our customers are. We have buyers and we have sellers. Most of you on the line would be focused on that buyer side. So those would be our customers that are dealing with our sales team, are looking to procure and ship products to their destination. And then on the seller side is what we have from our product expert that we'll be introducing in just a few moments. So a few more services of what we do. We're more than just an online catalog. We do have things like sales support and customer service and logistics and a rewards program, product training as we're doing right now, among other things. So we're more than just a platform. So a little bit more information just so you can understand our offices, some of our partners as well. I mentioned a little bit earlier those testimonials or what our customers have said. So you can come to this page here, which is just our testimonials page, and you can see things that are related to honesty and strong relationships, business growth, helping our customers' business actually grow as we work with them, reliable deliveries and positive impact. And again, some of those images showing successful deliveries or just strong relationships with some of our customers globally. Another page I mentioned here was our rewards points. So this is all about earning loyalty points as you engage with us. So there's a number of different ways you can earn. The best way obviously is to make purchases. So as you make a purchase, every dollar you spend earns rewards points. So you can see some of the basic details here for how you can actually earn, but also how you can redeem as well. So you can use your rewards points to redeem for discounts. It's the most common thing that people use their rewards points for, is to receive a discount on your upcoming order. So we've had customers buy samples for free or get massive discounts on an upcoming order. It's really just a way for us to thank you for your loyalty in working with us. Another really important page we found is our frequently asked questions. This is really just a page that is compiling all of the questions we've received over the years from our customers. And we found that if we heard a question more than a few times, it was obviously very important to our customers. And therefore, we made sure to add that to our frequently asked questions page. So this is all about where we're located, who our customers are, how was our business model developed, things like seeing prices on our website, or even just ordering, where we sell to, minimum order requirements, things like that. So quite a few questions here that should answer all of your information. And I think the key here again is for us to build trust and transparency with you, that we're not hiding anything. If you have a question, we're happy to answer it, and we probably already have here, but if not, feel free to reach out to us directly. So one of the other things we do is product training. That's one of the first questions customers ask us for, is do you provide training? And absolutely, yes, we do. So the first place you can look for that is this product training videos section on the site. This is all the webinars we've done over the last several years. So once we finish up this webinar today, we'll get that edited and added here as well. And we keep refreshing this content. So as a product maybe is no longer on our platform, we remove that video. So we've done far more than this over the years, but we keep optimizing this as we go. So the most important thing you're obviously coming here for is products, and almost everyone here is looking to learn about the MiraCradle Neonate Cooler, but they're also curious about what other products we have. So I mentioned earlier you can shop by category. So this is looking at different categories of products, whether it's pharmaceuticals, COVID-19, reproductive health, furniture and lighting, all the different categories throughout the medical field, and again, some of our popular products. You can also, there is the same. So one of the other things you can do there is, let me go back to the home page quickly. You can look at all of our products. So this is a view that I like to look at, especially just because, I think that's why. So one of the things here you can do, sorry about that, go to latest products there. So on the latest products, you can get to this where you're basically seeing a view of all the products, and then you can filter down. So that's the nice thing with the sort feature here, is you get furniture and lighting. You can click that, and that'll bring up all your furniture and lighting products. If you want to add reproductive health as well, you can tick that, and that'll bring up all your reproductive health. So it's a nice way to sort through your products, but what most people want to use is the search bar. So if you want to search for any product, it can be something generic like CPAP or phototherapy, something like that. That'll bring up all your results. But in this case, we're going to look at the MiraCradle Neonate Cooler. So just a quick update on the product page. I don't want to go into too much depth here, but the key is that you can find every piece of information you need on the page without having to wait for an answer from someone from our team. We want to put all of the tools in your hands to make informed decisions, and we want to cut down on your time in doing so as well. So you can see things like pictures, and we have a number of different pictures you can toggle through to see the product in use, or to see it more of a jelly shot as well, where you're seeing just the product there. You can see a short description. You can see these key bullets where it's very important information that you want to know, things like MOQ, warranty, regulatory approvals, all just there. A longer description, key features, specifications is an important one as well. Then we have accessories listed there, and then obviously things like brochures and manuals, which we know are very important. These are all listed here. If you just click on one of these, it'll bring up that page. Regulatory certificates, as well as videos. As I mentioned, we have our previous webinar from a few years ago, but there's other content that is in video form that we want to put there because it might be a useful tool for you. For this particular product, it actually has its own frequently asked questions section as well. So if there's anything related to only the MiraCradle, you can look at that here. There's case studies and trials, and then obviously warranty, package contents, and as well testimonials specific to the MiraCradle. So I know that's a bit of a mouthful. The idea is, again, to give you all the information that you could possibly need without having to ask us and wait for it. So we're trying to make it faster and easier for our customers as well. So before I introduce our product expert in a moment, I do want to introduce you to the questions section on the software. You can actually go into your software pop-up there, and in the questions section about halfway down, you can type in a question at any time. So if something during the presentation is coming up and it pops in your mind, please put that question in and hit submit. We won't go through the questions at first during the presentation, but at the end, there's a time for question and answer. That's when we'll go through all the questions that came in. So I really encourage as many questions as possible. It helps us to understand what maybe we didn't touch on. And we want to ensure that you walk away from this with a fully informed understanding of what the MiraCradle can do for you and for your clients in your clinical environments. So with that, I'd like to introduce Udit Mangal, who is the product expert with Plus Medical, focused on the MiraCradle Neonate Cooler.
Good morning to folks in West, and a very good day to everyone wherever you are. Thank you for joining in for this webinar. Over the next 1 hour, we'll spend time talking about basic concepts of therapeutic hypothermia and the use of MiraCradle Neonate Cooler. The way I've structured this webinar for everyone's benefit is to split this into 2 sections. One is where we will cover the basics of birth asphyxia and therapeutic hypothermia. And in section 2, we'll talk of the system as to how to treat this therapeutic birth asphyxia through MiraCradle Neonate Cooler. During the course of this, we'll touch upon as to what the problem of birth asphyxia is, what is its mechanism of neural injury, what are its effects, what is therapeutic hypothermia, how does it help, and where should the cooling be done, which baby should the cooling be administered on, what are the ways of care and monitoring the whole process, and what are the treatment devices available. And in section 2, we'll touch upon the technology of MiraCradle, its assembly, its use, clinical evidence that is generated, the impact that it has created, and the literature that is available for you to go through after this webinar. So according to WHO, birth asphyxia causes 24% neonatal deaths all over. This is also the second largest cause of neonatal mortality after premature or preterm deliveries. All in all, over 650,000 babies die every year because of asphyxia globally. And what is more alarming is that 90% of these cases are in developing or low-income resource countries. If I specifically talk of India, India faces a burden of 15 to 25 such cases per 1,000 live birth every year. There's a small trivia. While 90% of cases happen in low-income countries, Microsoft CEO son, Zen Nadella, also suffered in utero asphyxiation, and as a result of which he is visually impaired, has limited communication, and is quadriplegic. So the problem is widespread. It's not specific to certain sections. Yes, it is more prevalent in low-income resource countries. So what is birth asphyxia? In very simplest of terms, birth asphyxia is a medical condition where because of lesser oxygen flowing to brain, the brain has been subjected to severe abuse and has caused neurological disorder. It is also known as hypoxic, ischemic, encephalopathy. More on the technical terms, perinatal asphyxia. It is a medical condition in newborns which is caused by an impairment of respiratory function and leads to hypoxemia and hypercapnia, resulting in metabolic acidosis. Hypoxic event may occur either before the delivery, during the delivery, or after the birth, and it may affect brain as well as other organs. And in many cases, it either leads to death or severe brain injury. It could be as an outcome of several factors. For example, there could be fetal factors, maternal factors, and uterine factors. Amongst fetal factors, there could be situations like cord prolapse, tight cord coil, and shoulder dystocia. On maternal factors, if mother faces some cardiovascular collapse, that can also result in birth asphyxia. On the uterine factors, there could be uterine rupture, premature separation of the placenta, and henceforth. All in all, birth asphyxia is an outcome of prolonged hypoxic conditions created for babies at the time of delivery. Now, what is its mechanism of neuronal injury? This whole injury happens in a two-phase pattern. We call it as a biphasic pattern of energy failure. In the first phase, as you can see here, which we also call as primary energy failure, brain faces high amount of insult, and there is enormous amount of ATP reduction. But there is a chance of recovery, and this chance of recovery is known as latent phase. This is a phase before the secondary energy failure has been triggered. So this latent phase, it has been clinically observed, lasts for about 6 hours. That is also our therapeutic window, which means that this is our opportunity to save those babies which have faced this abuse. And our goal is to initiate the therapy as early as possible before the secondary energy failure triggers. What are the impact or the effects of asphyxia? We talked about death. It contributes to over 24% of neonatal deaths. But other than that death, it is also associated with several neurological disorders such as lack of consciousness, decreased or absent reflexes and muscle tone, seizures in a newborn baby. It yields in a very high rate of cerebral palsy up to 82%. The survivors of moderate and severe HIE have decreased IQ at the age of 2 to 6 years. They also face problems in school in terms of reading, spelling, maths. There are cases reported with autism spectrum disorders, aggression and anxiety issues. And in some cases, it may also lead to schizophrenia. Now, what is the cure? The cure essentially is therapeutic hypothermia. It is the only clinically proven medical intervention which can prevent death or reduce the magnitude of neurological severity faced by brain. What is therapeutic hypothermia? In a nutshell, it is controlled cooling of a baby to around 33 degrees Celsius and maintaining that temperature for as long as 72 hours or 3 days. Now, if I can draw your attention to this graph, therapeutic hypothermia has 3 phases. The first phase is called as induction phase. This is the phase when the temperature of the baby is brought down from a normal 36.5 degrees Celsius to 33.5 degrees Celsius. This has to be done as early as possible, typically say in 30 to 90 minutes time. Then there is phase 2. This phase is the maintenance phase. The objective of this phase is to ensure that baby stays at 33.5 degrees Celsius stably for as long as 72 hours. Then there is another rewarming phase where the temperature of the baby is brought back from 33.5 degrees Celsius to 36.5 degrees Celsius. This is a very important phase because the objective is not to bring to the normothermic temperature abruptly. That may lead to sometimes even hyperthermia, temperature shooting above 36.5 degrees Celsius, and that may cause more damage than doing good. So rewarming has to be done very carefully and very slowly at the rate of 0.2 degrees Celsius to 0.5 degrees Celsius per hour. And that takes about 8 to 12 hours for this temperature to come up from 33.5 degrees Celsius to 36.5 degrees Celsius. Now, how does therapeutic hypothermia help? There have been several studies to figure out as to what works in favor of therapeutic hypothermia in the case of birth asphyxia. And mind you, why we are talking of this is because cooling is not intuitive. Cooling has been discouraged all along. All premature babies have to be rather warm than cool. So what changes in the case of birth asphyxia? Well, in the case of birth asphyxia and through controlled cooling, there is reduction in ATP consumption, and therefore this gives a window of opportunity to brain to recover. There is decrease in accumulation of extracellular glutamate, which is a major mediator of excitotoxic injury. There is also reduction in accumulation of intracellular calcium, which has deleterious effects over biomolecules like lipids, proteins, and DNA. There is also a reduction of free radicals that mediate damage. Some of the apoptotic pathways also get blocked, and therapeutic hypothermia inhibits inflammatory mechanisms also. As a combination of all of these biochemical pathways in the body, therapeutic hypothermia provides a window of opportunity to recover baby from the severe abuse that they have faced. Some numbers of importance in therapeutic hypothermia. The cooling window period, as we discussed in the preceding slides, is only of 6 hours. So any baby that needs to be administered this therapy has to be done in first 6 hours of birth. The cooling has to be done very rapidly when it is initiated in the induction phase. Faster the better. Typically, it takes about 30 to 90 minutes to initiate, but if you have a baby who is already 5 hours of age or 6 hours of age, then you do it even faster. The target core body temperature has to be maintained between 33.2 degrees Celsius and 33.8 degrees Celsius for 72 hours. And rewarming has to be done in a very slow process with rewarming rates ranging from 0.2 to 0.5 degrees Celsius, and the whole rewarming spread over 8 to 12 hours. Now, another very interesting question, particularly in the context of lower and middle income group countries, is that where should the cooling be done? A lot of times in a lot of literature in past 10 years back, cooling, while it has been made a standard of care in West, was discouraged in low resource settings. For once and for all, let's clarify as to what setting should cooling be administered in. So first thing first, that these babies that we are talking about, babies that have faced the abuse of birth asphyxia, are very, very sick babies. There is no doubt about it. Other than complications that may arise out of cooling, there is a requirement of constantly monitoring these babies and administer intensive care throughout the course of their duration at the hospital. So therefore, what is mandatory to have in the setting is the ventilation facility. Central venous and arterial access should be there. There should be facility to administer inotropes. There should be also support for providing blood product in case it is needed, because there's profuse bleeding as well. There should be adequate nursing care available for continuous monitoring of vitals, and there should also be facility for long-term neurodevelopment follow-up. What is also good to have is AEEG for prognosis and sepsis detection, and MRI for neurological assessment. However, it is not mandatory. It is preferable, but not mandatory. Who should be cooled? As in, what should be the criteria for inclusion of babies for therapeutic hypothermia? So I have classified them as A, B, C criteria. A, mandatory criteria. B, physiological criteria, where any one of them can be met. And third is neurological criteria. The mandatory criteria is that the gestation age should be 35 weeks. We only cool term babies. We don't cool preterm babies. And the birth weight has to be 1800 grams. And cooling has to be initiated in the first 6 hours of birth. All of these criteria must qualify before taking a decision upon cooling. Some people would argue, why not cool beyond, say, 35, even say preterm babies, which are before 35 weeks of gestation. There is not enough clinical evidence on benefits of administering therapeutic hypothermia on such babies. And so is the case with babies who come after 6 hours of birth. Well, while these are mandatory criteria, doctors, based on their hospital protocols as well as other physiological and neurological criteria, can take a conscious call whether they still want to cool or not. So for physiological criteria, any one of them, if it is getting fulfilled, cooling can be initiated. Now, this differs slightly from Western clinical literature, where Apgar score at 5 minutes for less than 5 is the gold standard for inclusion. In India and in most India-like settings, mostly for outborn patients, there will not be any Apgar score. Babies who will arrive will come at about 3 to 5 hours of birth and will have history of having not cried at birth, not breathing normally at 5 minutes, or have been given assistance for breathing and are limp or are flaccid since birth. So therefore, it becomes a little difficult for outborn patients to decide upon the inclusion criteria, but clinically, these criteria have been established. For inborn patient, and if there is the luxury to only have inborn patient, APGAR score forms the very basic standard, 5 minute less than 5, and cord blood pH should be less than 7, and baby, if has needed resuscitation at 10 minutes, that's also a good criteria for inclusion. Amongst neurological criteria, we only cool moderate or severe encephalopathy babies which have been diagnosed so on modified Sarnat, any 3 of 6 criteria, or on Thompson's score, or babies who have been observed to have seizures. Now, on nursing care and monitoring, it is extremely important, as I said earlier also, that as alone, babies born with birth asphyxia have very critical conditions. They need intensive care, and more so when it comes to cooling, there could be some side effects arising out of cooling itself. So temperature is very crucial. We monitor temperature continuously. Initially, the temperature has to be monitored on 4-hourly basis, on 15 minutes for first 4 hours, and thereafter on an hourly basis. We don't rely on skin temperature, that is only as a backup. It has to be either rectal, and if rectal is not possible, then the esophageal. It has to be core baby's temperature and not the skin temperature. Heart rate also needs to be monitored at an hourly basis. Blood pressure needs to be monitored again on an hourly basis, and baby's position needs to be changed, and skin needs to be checked for observing any cold injury. This can be done on a 4-hourly basis. These are the vitals monitoring. At the same time, neurological monitoring is also important. Neurological assessment should be done at least once a day till rewarming. We follow either modified Sarnat score or Thompson score. A formal neurological assessment needs to be done at 1 week or at discharge. AEG, amplitude integrated EEG, can be done if it is available. It is good for prognosis and seizure detection. Neuroimaging should be done at the time of discharge or at 5 to 7 days of birth. One can use either ultrasound or MRI with MRS for doing so. But follow-ups up to 24 months of birth is very important. This should be done through tools available like GMA, Amyl Tyson, DDST, DASI. What is interesting here is that in one of the clinical studies published by Ecker et al., follow-up done after 3 months on GMA has a very high degree of correlation with MRI done at 5 to 7 days of birth. So for facilities where there is no neuroimaging available, results of GMA can be correlated with that. So in conclusion, therapeutic hypothermia is a widely accepted standard of care therapy in Western region. However, in lower and middle income group countries, it has not yet become standard of care. There is enough published randomized controlled trial data now which have demonstrated efficacy and safety of cooling. Meta-analysis of large trial outcomes have reported that benefits of cooling on survival and neurodevelopment outweigh the short-term adverse effects. So it is still advised to start cooling on babies, and the short-term adverse effects get reversed during the course of rewarming, and benefits clearly outweigh them. However, there is a need for close monitoring of the infant throughout that period, and not just that, it has to be coupled up with the follow-up up to 24 months of age. Now, the most important thing, what are the treatment methods available? How should the cooling be done? So current options were are either servo-controlled or ice packs. Servo-controlled machines are automated machines where the method of cooling is pretty active. They are accurate. They can bring down the temperature fast and maintain the stable temperature. However, the problem is that they cost a bomb. The cost of servo-controlled machines can run from, say, $20,000 to $30,000 and are not afforded by low-income group countries where, as we saw, maximum cases are anyway reported. The alternative methods that have been tried out are with frozen ice packs. The problem with frozen ice packs is that they are not accurate. They can cause subcutaneous fat necrosis and can also cause thermal shock to babies. And therefore, very close monitoring and changing of ice packs has to be done very regularly in order to achieve consistent results. So under this ambit, Plus developed an affordable device for treating birth asphyxia, which is now called as MiraCradle Neonate Cooler. This device was developed in collaboration with Christian Medical College, Vellore, about 5 years, 6 years back. And it is a breakthrough innovation in its own sense, because based on phase change material technology, the device is available at 1/10 the cost of standard devices, and therefore a clinically accepted method of treating birth asphyxia in the low resource settings. First thing first, as to what this technology is, phase change materials are specialty chemicals that can also be called as thermal batteries. They can absorb or release a large amount of energy, keeping the temperature constant, and they can do so at different temperature points. So in this case, our target temperature is 33.5 degrees Celsius. We use specific materials that can maintain specific and target temperature of 33.5 degrees Celsius for as long as 72 hours without the need for changing the material packs. This is very different from the use of ice packs. You know that ice changes its phase from solid to liquid at 0 degrees Celsius. And in doing so, it exposes babies to the risk of cold shock, because when you take out ice from, say, -20 degrees Celsius as frozen, and you put a baby onto it, it will give a cold burn to the baby. Why PCMs are better? As we just discussed, PCMs offer much precise and efficient temperature control. They also offer much higher backup hours, and they reduce the dependency on any external power source. So they act in a way where the PCMs can be charged and then applied on babies for through the course of therapy administration. They're made for repeat use. There are absolutely no consumables involved whatsoever, and it is extremely safe to be used with babies. There is no electricity also involved in the use of phase change materials. This is how the construction of the device is. It has 4 components. There is a base cradle, which is insulated. Then there's a layer of phase change material FS29, another layer of phase change material FS21, and conduction matrix. I'll take a moment to show you these components. This is the layer of SAVE FS29. This layer alone is good enough to maintain temperature of baby at 33.5 degrees Celsius. And 3 of such packs, like you see in this on the presentation slide also, 3 of these packs go in the insulated cradle body and are sufficient to maintain baby's temperature at 33.5 degrees Celsius for 72 hours. There is this another layer, we call it as FS21. This layer is used only in cases where the temperature is not reaching the target temperature. As the name indicates, this is 21 degree PCM, and therefore it brings down the temperature much faster than the 29 degree PCM. Then there is another component as conduction matrix. This is how the conduction matrix looks like. It has dual purpose and properties. First, it enables the heat exchange between babies and PCM materials. Second, it also offers as a soft bed for babies to lie on comfortably. Yeah, I'll move on to now the assembling and use. We have already seen as to how these components look physically. As I said, the first component is this insulated cradle. This cradle needs to be put in the bassinet of the standard warmer. Warmer has to be turned off. Then On top of it, we put 3 layers of, or rather 3 pieces of save FS29 PCM. This forms 1 layer. On top of FS29, there goes the conduction matrix, which forms the soft bed for babies. Now you would observe that you don't see FS21 layer in this representation. Why? Because FS21 is only to be used on SOS basis. So as standalone, FS29 degree PCM can maintain the temperature on its own, but only in cases where you're not seeing the temperature stable at 33.5 degrees Celsius, would you use FS21 layer. So this is an instruction board. We also provide this with the assembly. Typically, our target temperature range is 33.5 degrees Celsius. If we achieve this target temperature range, great. But if we do not achieve, we have to set the alarm settings in the multi-parameter monitor at 33.2, lower alarm, and at 33.8 as higher alarm. If the temperature is going below 33.2 degrees Celsius, this alarm would trigger, and one needs to turn the warmer on in the manual mode with about 10 to 20% of output. This warmer needs to be turned off as soon as the temperature reaches the target range of 33.5 degrees Celsius. Similarly, if the alarm goes off when the temperature is not dropping below 33.8 degrees Celsius, as I said, another layer of FS21 needs to be introduced in between. And this layer needs to be removed once the temperature, target temperature is achieved at 33.5 degrees Celsius. So this is the only manual intervention in the whole assembly. And rest, the assembly in itself will be able to maintain the target temperature for the entire duration of therapy of 3 days. In terms of features and benefits, the device is clinically approved. It is CE certified. It is extremely efficient. The temperature control is very precise for as long as 72 hours. It is economical, available at 1/5 or 1/10 the cost of other servo control devices. Very easy to use, minimal supervision required. You don't have to change PCMs as often as one would do with the frozen gel packs. Long lasting, these PCMs are designed for repeat use. There are no consumables as such, and it is safe for babies because there's no electrical components involved at all. In terms of clinical evidence, today there is enough clinical evidence generated on MiraCradle. On your right, you observe one of the studies published in Pediatric Journal of India in 2017 by Thomas et al. You can observe from the graph that the temperature is quite stable at 3.5 degrees Celsius with standard mean deviation of just about 0.39 degrees Celsius. First study was published in 2015, which was conducted on 41 babies at Christian Medical College, Vellore. The mean standard deviation temperature was just about 0.26 degrees Celsius. The second study was published in 2017. It was a multi-centric study conducted at 10 different hospitals where 103 babies were recruited. And as you saw in the graph here, the mean, the standard deviation of temperature was just about 0.39 degrees Celsius. There were other independent studies conducted by Saraswat et al. It was conducted in one of the tertiary care settings in South India, Bapuji Child Health Institute, where 50 babies were recruited. And this study concludes that MiraCradle is an effective device in reducing asphyxia-induced morbidity in resource settings. Then there is a randomized control trial study published by Aker et al. This is a recent study got published in about 1.5 years back in Archives of Disease and Child Fetal Neonatology edition 2019. This study recruited 50 infants in India, and what it concluded was that through MRI, which was available for 46 infants, it demonstrated significantly less moderate or severe abnormalities in the cooled babies over the non-cooled babies. Another randomized control trial got published just about a few months back by Catherine et al. This got published in Journal of Tropical Pediatrics 2020. And this trial recruited 200 infants in India with that were diagnosed with HIE. And it concluded that therapeutic hypothermia reduces mortality and neurological abnormalities and result in more normal survival. All of these studies are also uploaded on the VIA Global Health page of MiraCradle. In terms of installation base of MiraCradle, it is today installed at over 500 plus hospitals in lower and middle income group countries, spread over the continents of Asia and Africa. Some of these names are from India: Christian Medical College, Vellore, JIPMER, Pondicherry, St. John's, All India Institute of Medical Sciences, Government Medical College, and so on. It is also installed in the African settings at Nkoma Mission Hospital in Malawi, Yusuf Dadu District Hospital in Johannesburg, South Africa, Kenyatta National Hospital in Kenya, and Zitwele Hospital in South Africa. In terms of impact, the device has impacted lives of 20,000 plus babies every year. It is India's largest selling neonate cooler. As we saw, it is installed at over 400 hospitals in India alone and over 500 hospitals worldwide. And this number is much higher than combining all the other servo control machines installed in India. These are testimonies by professors from JIPMER Pondicherry in India, as well as from Cloud9 Hospital. In terms of literature available, all of this is uploaded on VIA Global platform, brochures, manual, and frequently asked questions. There are several white papers one can refer to. These are again uploaded on VIA Global platform. Then the publications, as we saw, all of these are there, one can refer to. And there's also a training video as well as manual on the entire therapy and not just on MiraCradle, uploaded on VIA Global platform. So that's about it. These are awards and accolades that MiraCradle has achieved. It achieved award from WHO and got included in its compendium of most innovative healthcare technologies in 2014. The device is patented. It also received award from Government of India as being one of the most innovative technologies of the year 2017. It has been incubated under the DST Lockheed Martin India Innovation Growth Program. It has been funded by Millennium Alliance and USAID for piloting in several states in India. It has also received the MIT Innovators Under 35 India Award in 2017. Has been twice recognized by CII, which is Confederation of Indian Industry. The design has been awarded India Design Mark and was incubated under National Institute of Design Clinic scheme and developed in collaboration with CMC. So in a nutshell, MiraCradle offers extremely efficient therapy, which is validated in an ergonomic design, which is safe, easy to use, lightweight and portable, and at a very affordable cost. These are some of the glimpses of where MiraCradle is installed and how it has helped the lives of babies. These babies have actually been treated on the device and are leading a normal life today. So thank you. That's it from my side. I'd be happy to take questions if any.
Perfect. Thank you so much. That was extremely informative, very thorough. So I think you've actually answered quite a few of the questions ahead of time. If you can actually just turn off your screen share just so we can get full screen on you. We're getting a bit of a, there we go, perfect. So I will try to just weed out some of the basic questions that weren't already answered. You did answer quite a few from people based on power requirements, any consumables, temperature ranges, things like that. So I really appreciate the thorough nature. I think the first one that's come out from a few folks is just, I know you did a comparison between the PSM, the MiraCradle versus things like ice bags and ice cubes. Are there any other competitors that this could be compared to, and what would make the MiraCradle stand out versus them? Or is it really just that the kind of ice treatment would be the most common competitor?
Thank you, Brian. As I said through my presentation, that therapeutic hypothermia is a standard of care treatment in the Western world. And there, the devices that are used more often are servo control devices. The problem with countries like India and in Africa is that these devices cannot be afforded by most settings. They cost as high as $20,000 to $25,000, and these are the settings which face the burden of asphyxia the most. As I also said, that 90% of these cases are observed in such settings. So the only alternative left to such settings was to either try out frozen ice gel packs or look out for other ways of cooling babies, which is far more precise, clinically proven. MiraCradle offers that position to these facilities, where it can be offered at 1/10 the cost of the standard devices and still the confidence of a clinically validated therapy through a clinically and CE mark device.
Okay, perfect. And just a reminder for everybody on the line, if you do have additional questions, feel free to type those in now. We do have a handful of questions to go through, but if there are any additional, this is a great time to add those in so that you have your chance to give your voice. I guess the next one that came through from a few folks, just kind of building on the PSM, you talk about the different temperature ranges and how it brings the infant to that 33 to 34%, 33 to 34 degree range. A couple people just weren't quite sure, how does I guess the device itself get to that temperature? What process needs to happen to bring those components of the MiraCradle to that temperature, or do they just come that way?
Okay. Yeah, thank you again, Ryan. This is an interesting question because it talks of the core of the technology that we discussed, phase change material. These are very specialty materials that have a unique property of changing their phase, keeping the temperature constant. So for example, if you look at ice, we all know changes its phase from solid to liquid, liquid to solid at 0 degrees Celsius. So at temperatures below 0 degrees Celsius, ice will stay as ice, but at temperatures above 0 degrees Celsius, it will start to melt and flow like a liquid. Now, when it comes to cooling babies and maintain specific 33.5 degrees Celsius temperature, you need a material which behave like this, but does not do so at 0 degree, but at a different specific point. Here in this case, our target temperature is 33.5 degrees Celsius. Plus, advanced technology, because of its expertise and rich experience in material sciences, has developed such proprietary materials that can do so. These are chemically engineered materials which can hold on their temperature at a specific point and absorb all the external energy without letting the temperature change, and utilize that energy in changing its phase. So what essentially happens is that when you use an FS29 material, it has its phase change temperature at 29 degrees Celsius. Baby has its normothermic temperature as at 36.5 degrees Celsius temperature. Now between 29 to 36.5, the equilibrium gets established at 33.5 degrees Celsius. We are achieving that equilibrium by virtue of the properties of these materials. And these have been synthetically designed to hold on temperature at 29 without changing their phase for as long as 72 hours. That's how it works. Now, why do we offer two different kinds of material, FS21 and FS29? There could be, during the process of achieving this equilibrium, there could be times when the target temperature is not being achieved. For such situation, we offer a different degree material which offers extra cold over 29 degree material. This is a 21 degree material and is able to pull down temperature much faster. The moment that temperature is achieved, which means that the equilibrium is established, you remove that material. Similarly, when the target temperature is is not achieved and the temperature is higher, is lower, then you turn the warmer on in the manual mode. Now these warmers are available all over the place at almost all facilities. The design of MiraCradle is also such that it fits in the standard bassinet of a warmer. You put this device in that warmer. The warmer will be off throughout the therapy, but only in the process of achieving equilibrium. And if it is not being achieved on its own, you turn the warmer on in manual mode. As soon as the target temperature is achieved, then these materials on their own are able to sustain it for as long as 72 hours. So that's about it. I don't know if I've specifically answered as to how they do it, but it is a It is sort of a quasi-automated system that gets generated by virtue of the properties of these materials, where the temperature is held at a specific point of 33.5 degrees Celsius and maintained for 72 hours.
Thank you. I think that definitely helped me understand it. I think for some people it's just not as common of a process. I think there's typically a refrigeration process or something similar, but I think that was an excellent explanation for how this works. It's just, I think, a little bit more complex than what we're accustomed to. So I appreciate that a little bit additional time you spent on that. So just a couple more. So one came about the lifespan of the product. Is it based on number of uses or length of time, or is there even a lifespan that you've noticed?
Well, the device has been extensively tested for use years after years. However, Plus recommends to change these materials after, say, 3.5 years of use, and if a performance dip is observed.
Okay. And would that be the same for each layer of the MiraCradle, or are there certain, like the cradle cannot last longer than an FS21? Are there differing lifespans for each layer?
Yeah, nothing happens to cradle. In fact, nothing happens to any of these materials, but the phase change materials, both layers, FS29 and FS21, they are recommended to be changed after 3 years of lifespan. Cradle can stay for as long as it does not break.
Okay, perfect. And then just a question about sterilizing. I know that obviously the top layer must require some level of sterilization or a replacement. What would be the recommendation for how to sterilize the unit between treatments?
Very common lab practices of using 70% isopropanol, and that would be all. Just needs to be wiped off. Nothing extra needs to be done. In fact, baby, during his stay on the device, would also pass meconium a lot of times. So it is also advised that on the top layer, a thin linen sheet is spread, and that can be changed, each time it gets dirty. For the device and its components, just 70% isopropanol would do.
Okay, perfect. I know you also did touch on this in the presentation about the different clinical environments. There's a few other questions just kind of following up about that. People may have come in a little bit late. Can you just touch on a few seconds about what the recommended clinical environments would be for the MiraCradle?
Yeah, sure. We must acknowledge first that babies who have faced the abuse of birth asphyxia are extremely sick and ill babies. So other than the requirements of cooling itself, these babies need intensive care. Therefore, they are recommended or rather mandated to be treated only in NICU level, neonatal intensive care unit level 3 facilities. Now, what should these facilities minimally have? These facilities should have provisions of continuous vital monitoring, heart rate monitoring. These facilities should also have ventilation support, blood support, and all of that. Other than that, if there are devices for neuroimaging as well, it is preferred or it is recommended, but it is not mandatory. So it would suffice to say that therapeutic hypothermia should only be administered in settings which have intensive care available.
Okay, perfect. I just wanted to make sure that people heard that directly. I appreciate you going through that again. Again, you really covered so many of the questions in your presentation. It was so thorough. I'm not seeing anything else that's jumped out that wasn't already covered in your presentation. I'm curious, in the last number of questions, has anything else come up into your head that maybe you forgot during the presentation, or a new idea popped up based on a few of the questions that have come through?
Well, I would say, based on the experience that I've gathered from the African market particularly, is that cooling has not been practiced in those markets as yet. However, Africa faces one of the highest burden of birth asphyxia related deaths. It is high time that cooling is also given as, if not as standard of care, but at least as an optional treatment to babies through consultation with and counseling of parents. There is enough clinical evidence available today. There are now devices like MiraCradle available, which can help administer this therapy in the low resource settings at very less cost. Let's not leave such children who have faced this abuse to the fate of death or neurological burden as they grow up. Let's treat them. Let's start with few babies. Let's give each baby a right to live.
I think that's very well said. Thank you. I'm going to just steal quickly the presentation and take everyone back to the product page so everyone can see again the details. I know there's been a few questions for things like warranty, which I didn't want to cover again, but that's listed here on the product page, or even package contents. That was a question that came up as well. But I do want to just remind everyone that you can come here and request pricing. So there was a few questions on pricing, which we don't cover in the webinar. But if you do want to request a quote or look to make a purchase, you just click that request pricing button, put in your information about what country you're going to, the city, the quantity. There's a bit more information just about your company you would submit. You can also email us directly at sales@viaglobalhealth.com. Again, that's sales@viaglobalhealth.com. So again, this is your resource to find everything you could possibly need, but we do welcome your direct contact as well, because we have a sales team that will work with you personally. But Udit, I appreciate your time and your thorough nature of the presentation. I think this was extremely helpful and informative. So I want to thank you again. And for everybody on the line, I want to thank you for your time and your attention and your questions. And we look forward to having you on the next VIA Live product training series. Thank you all very much.
Thank you. Thank you, Brian. Thank you, everyone.